welcome. It is Friday, May 1st. We are hosting our Friday knee replacement Q&A. So what does that mean? It means that Dr. Sinha, my husband Raj, and I, Diana Braun, are here. We are the ones who wrote Knee Replacement Secrets, and we do our best to go live on most Fridays for you to be able to ask questions you have about knee replacement, whether you're preparing, avoiding, or maybe you're in the middle of it right now. Maybe you are trying to recover and you cannot sleep. You cannot get comfortable. You are swelling. You thought, I had this 2 weeks ago. I thought I'd be like running a marathon by now. What's going wrong? So we're here to answer all of your questions. I had bilateral knee replacement myself 2.5 years ago. So I try to post a video every single day on Instagram and Facebook to help educate you on what you can expect, give you tips and tricks, and that's really why we show up here every week. All right, our next question just came in from Aunt Jones 1. She's 3 months right knee replacement, and thank you. If you're dropping a question, we need to know when your knee replacement was. And if we ask you more follow-up questions, just kind of remind us who you are, because we're seeing lots of questions come in. But she's 3 months right knee replacement, and she's asking, I think this is a great question. She's had the knee replacement, and now she's like, hey, how do I make sure I avoid getting an infection? And I had an exchange with somebody yesterday that was being told, like, hey, if I need dental work, I was told I have to take antibiotics to avoid possibly getting an infection in my knee. That doesn't make any sense. And so can you weigh in on that? Because, and other things people should do to avoid getting an infection in their brand new knee, because I know you have some unfortunate outcomes from people that didn't follow their directions on what to put on their knees. You might want to share or not.
Yeah, so infection after knee replacement can occur at the time of surgery. That's what we call an acute infection. Usually within the first 3 to 4 weeks it starts to show itself. And those need to be aggressively managed and treated. If you're 3 months out now, no signs of infection, the issue about preventing infection boils down to a couple things. One is, if you have an infection somewhere else in your body, you want to get on antibiotics right away. You don't want any bacteria from that infection to get into your bloodstream and travel through your blood into your artificial joint, because it becomes much harder to take care of. It usually requires more surgery. The common thing is dental procedures. So, you know, for 50 years, we've told people, if you're going to get your teeth cleaned, even routine cleaning, you should take a dose of preventative antibiotics. And typically, you just need one dose. First generation, you know, amoxicillin, Keflex, cephalexin, one of those things is typically sufficient. There's data coming out now that suggests maybe that's overkill. I know the infection doctors have been a little bit concerned about over-treating with antibiotics, but you know, my argument is these are first generation. We still don't have clear-cut in the science for what we call longitudinal data. We have a lot of retrospective registry type of data showing that people didn't get infections, but the problem there is we don't know how good the collection of that data was, and so it's a whole garbage in, garbage out theory that, you know, people in the coding world know about. So I still recommend that you take one dose of preventative antibiotic before you get your teeth cleaned routinely. Any other surgery also needs to have antibiotics for that surgery specifically, but also to protect your knee replacement. Topical type of surgeries like freezing moles, even cataract type surgery, because they're not truly internal, they don't need preventative antibiotics. Although when you have your cataracts done, your ophthalmologist will put you on some sort of topical antibiotic. What else? Colonoscopy is another one that I get a lot of questions about. Again, I still recommend that because there is translocation of bacteria through the colon wall into the bloodstream. Anytime bacteria gets into your bloodstream, it can get to your artificial joint. It's a very comprehensive answer.
It's interesting. So one end of from your mouth to the other end. Think about these things to avoid infection. And we do talk a little bit about this in the book, Knee Replacement Secrets, as well. I remember, what was it? 2.5 months after my knee replacements, I had a crown come out. And I was a little bit panicked because it was pretty early on. And so I knew I needed to take antibiotics before I went. And it's really important, especially if you've just had your knee replacement, make sure whenever you go to the doctor, particularly the dentist, you tell them you had your knee replaced. It's really important that your dentist know this. You wouldn't believe all the bacteria that's in your mouth. And, I've had people that I've had a lot of exchanges with, like, oh, I don't want to take antibiotics. I'm like, okay, but here's something to think about. And if your surgeon and your dentist are recommending you do this, you decide not to, would you rather go through having your entire knee replaced again because you got an infection in that new joint? I think for most of us, that answer is absolutely not. Don't want to have to do this ever again. So popping an antibiotic before you get your teeth cleaned or you have an emergency dental procedure done, I'm all for it. Just saying. So
me too.
So Aunt Jane, I hope that answers. And Jittery June, my newest friend I made this week. She had said, like, her surgeon said to avoid getting her teeth cleaned for 6 months. If you can do that, that's great. But emergencies happen. If it happens, it's okay. Just make sure you have an antibiotic in hand. Let your dentist can call it in or your surgeon can call it in. I mean, pro move for me is just go ahead and get the antibiotic filled ahead of time so you always have it available, because we never know when a crown's going to fall out, so just be prepared. So,
or when you're preparing dinner and you actually cut your finger, clean it up, pop an antibiotic.
Yeah. So, all right, everybody, have a great weekend. We're glad you came.
Have a great weekend, everybody.
All right, bye.